All right, welcome back to the deep dive. This time, we're diving into some stuff that's really going to make you think. We got this batch of sources all about medical practices, the stuff we kind of just accept as like the truth.
Yeah.
But some of these sources are saying maybe we shouldn't be so quick to just accept everything. We're talking fluoride, cancer screenings, even like how we deal with a fever.
Mm-hmm. Huh? Yeah, what's fascinating is this isn't some like fringe group out there. We're actually looking at a chapter from a pretty well-respected book, and it's saying a lot of what we consider like medical gospel. It might not actually be based on, solid evidence like we think.
That's wild. And they're not just saying it, they're backing it up. They're citing studies, like one where they put all these common medical practices to the test.
Oh, wow.
And get this, like 40% of them didn't actually hold up.
Oh, wow.
Kind of makes you wonder, what else are we getting wrong?
It really does. And,
Yeah.
The chapter makes a good point about how research funding often favors big pharma. So, like, we might not have the full picture when it comes to things like, lifestyle and nutrition.
Totally. Okay, so this chapter goes after 10 medical practices, calling them more dogma than science. And first up is something that I think a lot of us grew up with, fluoride in the water.
Right.
We're always told it's good for our teeth, prevents cavities. But this chapter is saying, hold on, maybe it's not all it's cracked up to be. And maybe there's even some downsides we're not talking about.
Yeah. One of the big things they bring up is the potential impact on our microbiome.
A what now?
The microbiome, it's like this whole community of bacteria living in our gut.
Yeah.
It actually plays a huge role in our overall health.
Okay, so like those probiotics you see advertised all the time.
Exactly, like that. And what's really interesting is the chapter highlights a study that found a possible link between a mother's exposure to fluoride during pregnancy and lower IQ scores in her kids later on. Yeah, kind of makes you think twice about those fluoride treatments at the dentist, huh?
For sure. Sounds like the good stuff about fluoride might be overblown. And maybe we should be paying more attention to the potential downsides. Especially when it comes to, developing brains. I gotta say, this whole fluoride thing, it's got me rethinking my stance a bit.
Yeah, and I think that's the point, right? Not to like totally demonize fluoride or anything, but to just encourage people to, look at it from all sides. The evidence for how good it is might not be as strong as we think. And we definitely need more research on any long-term effects it could be having.
Absolutely. Okay, let's switch gears for a sec. Talk about something a little more, shall we say, controversial. Marijuana. There's this growing idea that it's basically harmless, but this chapter is pushing back on that. They're saying we might be downplaying the risks, especially for younger people.
Yeah, it's important to remember that, marijuana today is not the same as it was years ago. The potency has gone way up, like way up.
What do you mean?
Like THC levels are way higher than they used to be.
Yeah.
It's not even the same plant practically.
So you're saying it's like comparing apples and oranges.
Exactly. And I think that's why we're seeing more and more research linking early marijuana use to a bunch of mental health issues later on, like increased risk of schizophrenia, depression, things like that.
Whoa, that's not good. Sounds like the whole harmless marijuana thing might need a reality check.
For sure. And, it's not about being anti-marijuana. It's about being honest about the risks.
Yeah.
Especially for young people. Their brains are still developing. The chapter even talks about that whole gateway drug theory. Whether you believe it or not, it's a conversation worth having.
Oh, absolutely. Especially with all these legalization debates happening everywhere. And speaking of things we just kind of do automatically, let's talk about fever. How we just reach for the Tylenol every time.
Mm-hmm.
This chapter made me seriously rethink that.
Mm.
Do you give your kids Tylenol every time they have a fever?
I used to. But this chapter, it gave me pause. We're always told fever's bad, like it's the enemy. But actually, it plays a big role in our immune response.
You're telling me a fever might be a good thing?
In a lot of cases, yeah. It's our body's way of fighting off whatever's making us sick.
Hey.
And when we just automatically knock it down with meds, we could be messing with that whole process and actually making the illness last longer.
You know what? I remember reading about a study where kids with chickenpox who got meds to lower their fevers actually stayed sick for longer.
Right, exactly. Of course, fevers can be uncomfortable, and we don't want anyone suffering unnecessarily. But the point is to maybe be a little more mindful. Maybe we don't need to grab the Tylenol every single time the temperature goes up a bit.
I hear you. I hear you. Find that balance between comfort and, letting the body do its thing. And it's not just about chickenpox either. The chapter is also talking about the long-term safety of things like Tylenol, especially for kids, how it could affect their brains. Have you heard about that?
Yeah, there's definitely some growing concern about that. How using these meds a lot, especially in kids, could have unintended consequences later on.
Wow, so much for that harmless, over-the-counter remedy. This is all really pointing to how we need to be thinking more critically about our health, even with stuff we just do without thinking.
Oh, yeah, absolutely.
And this next one, this is a great example of that, the Gallery test.
Okay.
It's this liquid biopsy that claims to detect, all kinds of cancer super early.
I've seen those ads.
It sounds amazing, right? Like the total game changer. But this chapter is saying, hold your horses.
Really?
Yeah, they're highlighting some pretty serious concerns about it.
Like what?
Well, for one, it's got a high rate of false positives. Like in one study, over half the people who got a positive result didn't actually have cancer.
Oh, wow. That's a lot of unnecessary stress.
Exactly. Imagine you get that news. You're going to be freaked out, right? You're going to go through more tests, biopsies, maybe even some pretty invasive procedures, all for something that might not even be there.
Yeah. That's a lot to go through for nothing.
And then on top of that, the chapter points out that even when this test does find cancer, it's often at a later stage, when it's already harder to treat.
So it's not really the early detection miracle they're making it out to be.
Not necessarily. And here's the kicker. The studies on this test haven't actually proven that it saves lives.
Wow.
So we could be putting people through all this stress and these procedures without even knowing if it's actually going to help them.
Yeah, that's concerning. It's a good reminder that new and shiny doesn't always mean better. We got to be careful about jumping on these new technologies before we really understand what they can do, both good and bad.
Totally. It's like, what if we focused more on preventing cancer in the first place?
Right.
Through lifestyle changes, stuff we know works, instead of jumping on this test that may or may not actually help.
This chapter is really making us rethink how we approach healthcare in general.
It is. And speaking of rethinking things, this next one is, it might raise some eyebrows. Testosterone replacement therapy.
Okay.
Or TRT for short. Now, I know there's a lot of stigma around this, but this chapter is suggesting that maybe it's underutilized, in men who actually have low testosterone.
That's interesting.
What do you think about that?
Well, first off, it's important to be clear. TRT is not the same as hormone replacement therapy for women.
Okay.
That's often called HRT, and they're not interchangeable.
Gotcha.
But just like HRT can be helpful for some women, TRT can be beneficial for some men. Those who are experiencing symptoms related to low testosterone.
Like what kinds of symptoms?
Things like low energy, low libido, weight gain, even sleep apnea. The chapter actually mentions this one doctor who's seen patients on TRT experience some pretty significant improvements in their mood, their energy levels, even their sleep. Like some of them were able to ditch their CPAP machines.
Wow, that's impressive. So it's not just about, building muscle and looking good like some people think.
Right. It's about addressing a real hormonal imbalance that can seriously impact a man's quality of life.
I see. But of course, like with anything, there are risks, right? The chapter talks about things like dependence, side effects.
Yeah, for sure. It's not a magic bullet. Any decision about TRT should be made carefully, with a doctor who knows what they're doing. But I think the chapter's point is that we shouldn't dismiss it out of hand.
Yeah.
Just because of the stigma. It's a legitimate treatment option that deserves to be considered for men who might actually benefit from it.
Okay, now this next one. This is a topic that always seems to spark a lot of strong opinions, and that's gender-affirming care for children, especially the use of hormones and surgery. This chapter goes into it, and I think it's important to approach this carefully, with respect for everyone's viewpoints.
Absolutely. There are definitely different perspectives on this, and they all deserve to be heard.
For sure. So the chapter highlights two main perspectives. On the one hand, you have the view that medical intervention is sometimes necessary for kids who are born with intersex conditions, where their biological sex isn't clearly defined.
Right.
And then on the other hand, you have the gender-affirming view, which emphasizes a child's right to choose their gender identity, even without any biological differences. And this view often supports medical interventions like puberty blockers, hormone therapy, even surgery, to align a child's body with their gender identity. And the chapter points out that the way this issue is handled is really different between Europe and the United States.
Interesting.
In Europe, there's been a shift towards more cautious policies.
Okay.
Some countries have actually restricted the use of puberty blockers in kids because of concerns about the potential long-term effects.
Right.
While here in the U.S., the debate is a lot more, polarized. There's strong support for access to gender-affirming care. But there's also growing concern about the lack of long-term studies on how these interventions affect kids in the long run.
Yeah, it's a complex issue for sure.
It is, and the chapter emphasizes how important it is to have open and respectful dialogue about this, to allow for different opinions and perspectives without, shutting people down.
Totally. We need to be able to have these tough conversations without attacking each other or trying to silence dissent. The well-being of these kids should be our top priority. And that means carefully considering all the evidence and all the different viewpoints.
Absolutely. Okay, let's move on to something that's becoming more and more common. The practice of cutting the frenulum under a baby's tongue. For tongue tie.
Oh, yeah.
I've heard about that. Some of my friends have had it done for their babies. What's the issue with that?
Well, the main concern is that the evidence for it is actually pretty rank. Like a big review of studies found no real benefit to cutting the frenulum. In terms of improving breastfeeding outcomes, which is the main reason they do it.
Really? That's kind of scary, especially since it's a procedure and all procedures have some level of risk.
Exactly. And it gets even weirder because some practitioners are going beyond just snipping the tongue tie. They're also cutting the baby's cheeks, even the inside of their upper lip.
What? Why?
To be honest, there's not much justification for it. These extra procedures often don't have any scientific backing. And we don't even know what the long-term consequences could be.
It's kind of wild to think that something so common, a procedure on babies, is based on such shaky ground.
I know, right?
The chapter is calling for a proper clinical trial to figure out what the real benefits and risks are before we subject millions more babies to this.
I agree. It's a good reminder that just because something is common practice doesn't mean it's safe or effective. We always need to be questioning our assumptions and demanding evidence. Especially when it comes to procedures on, vulnerable populations like infants.
This all seems to be pointing to this bigger theme of questioning assumptions, even in areas where we thought we had it all figured out. It reminds me of that quote, "The important thing is not to stop questioning."
I love that quote. It's all about staying curious, staying skeptical. That's what good science is all about. And it's how we make informed decisions about our health.
For sure. We've covered a lot already, but we're just getting started. Stick around for part 2. We're going to delve even deeper into these medical practices and talk about what it all means for you, the listener.
Yeah, looking forward to it.
Me too. See you there.
All right. That 40% of common practices not holding up, still thinking about that, really drives home the point, doesn't it? We got to be more careful about what we just accept as, medical fact.
It's like we've been on autopilot or something. Just trusting that whatever the doctor says is, backed by science. But as we're seeing, that's not always how it is.
Yeah, and the chapter brings up some examples where things we thought were helping people turned out to be doing more harm than good.
Oh.
Like the overuse of heart stents.
Heart stents.
Yeah, for years, doctors were putting these tiny tubes in people's arteries, thinking it would help them live longer.
Right.
But then this big study came out, and it showed that in a lot of cases, stents didn't actually improve survival rates at all.
So people were having this procedure with all the risks and everything, and it wasn't even helping.
That's what the study found.
That's pretty scary.
It is. And it's not just stents. The chapter also talks about the opioid crisis. How it started with this idea that opioids weren't addictive.
Oh, right.
For decades, doctors were prescribing them like candy.
Wow.
And it led to, widespread addiction and a ton of overdoses.
That's a tough lesson. Shows what can happen when we just blindly follow medical dogma. Makes you wonder what else we're doing now that we'll look back on and be like, what were we thinking?
It's a good question. And that's why this whole idea of being more skeptical in medicine is so important. It's not about distrusting all doctors or anything. It's about being an informed patient.
Yeah, taking charge of your own health.
Exactly. Asking questions, doing your own research, understanding the risks and benefits of any treatment before you agree to it.
Absolutely.
And the chapter also talks about the need for more independent research, especially when it comes to things like nutrition and lifestyle.
Like what you eat and how much you exercise can affect your health. Seems kind of obvious, doesn't it?
You'd think so. But the truth is, most research money goes to studying drugs.
Oh, right.
Drug companies, they have a big incentive to study their products. But there's not a lot of money to study things like diet and exercise.
So we could be missing out on important info about how to stay healthy just because those solutions aren't profitable.
It's a real possibility.
Yeah.
And it brings us back to the microbiome, that whole ecosystem of bacteria in our gut.
Right.
It's a relatively new area of research.
Yeah.
But we're learning more and more about how important it is for our overall health. And this chapter raises some concerns about how things like antibiotics and fluoride could be disrupting that balance.
Interesting.
You don't know the long-term consequences yet.
So it's not just about what we put in our bodies. It's also about how we affect what do you call it?
The microbiome.
The microbiome, right. All those tiny organisms living inside us.
Exactly. It's a whole new way of thinking about health.
This is all pretty eye-opening stuff. So what can our listeners actually do with all this information?
Well, the main thing is to become more empowered patients. Don't be afraid to ask questions.
Like what kinds of questions?
When your doctor recommends something, any treatment or test, ask why you need it, what the evidence is, what the alternatives are, what are the risks, what are the benefits, both in the short term and the long term.
Yeah, sometimes it feels like you're not supposed to question the doctor.
I know, but remember, doctors are people too. We have biases, we make mistakes. A good doctor will be happy to answer your questions and address your concerns.
Okay, so ask questions. What else?
Do your own research, but be smart about it. Don't just believe everything you read online.
Right. Dr. Google isn't always right.
Exactly.
Yeah.
Stick to reputable sources like medical journals, government websites, things like that.
And remember, just because your friend's aunt's cousin swears by some remedy doesn't mean it actually works.
Right. Look for evidence, for studies.
Yeah.
Especially large, well-designed studies. And be careful about information that comes from people trying to sell you something.
Okay, so ask questions, do your research. What's next?
Get multiple opinions. If you're not sure about a diagnosis or a treatment plan, don't be afraid to talk to another doctor.
It's like getting a second quote from a contractor, right?
Yeah, exactly. You want to make sure you're getting the best possible advice. And it goes back to that idea of groupthink in medicine. Sometimes you need a fresh perspective to see things clearly.
Okay, so we've got ask questions, do your research, get multiple opinions. Anything else?
Be wary of the parachute argument.
The what?
It's this idea that some things are so obviously true that you don't need to test them.
Oh, okay.
But that's not always the case. Like with the heart stents, it seemed logical that they would help. But the evidence didn't support that.
Right.
We always need to demand evidence, especially when it comes to things that have risks or are expensive.
Okay, last question. What's the most important piece of advice for our listeners?
Be your own advocate. Don't be afraid to speak up for yourself. If something doesn't feel right, if you have doubts, say something.
It's about having a good relationship with your doctor.
Absolutely. It should be a partnership, not a one-way street.
You're the boss, basically.
In a way, yeah.
This has been a lot to take in. We've really dug deep into this whole medical dogma thing.
It's been fascinating, for sure.
And hopefully empowering for our listeners.
I hope so. I think it's important for people to be more aware of this stuff.
I agree. As we wrap up this part, I keep thinking about that quote by Carl Sagan. Science is a way of thinking much more than it is a body of knowledge.
That's a good one. It's about being curious, questioning things, being open to new ideas.
Exactly. So to all our listeners out there, keep asking those tough questions. Keep digging for evidence. Keep fighting for your health.
It's a lifelong journey.
It is. Thanks for joining us on this deep dive. We'll be back soon with part 3.
Okay, so we've spent a lot of time talking about this idea of medical dogma. Those practices we just accept without really questioning them. But now let's get practical. What can our listeners actually do with all this information?
This chapter isn't meant to scare people. It's not about making you paranoid about everything your doctor says.
Right.
It's about giving you the tools to be more in control of your own health.
Okay, I like that. So how do we do that?
Well, first of all, don't be afraid to ask questions. Questions.
Yeah, lots of them. When your doctor recommends something, a treatment, a test, whatever, don't just say, okay, sounds good. Ask why you need it, what the evidence is, what are the other options, are there any risks, any side effects, both in the short term and the long term.
I think sometimes people feel intimidated to do that, like they don't want to challenge the doctor or something.
I get that, but doctors are people too. We don't know everything, we make mistakes. A good doctor will be happy to answer your questions.
Okay, so ask questions. Got it. What else?
Do your own research.
Okay.
But be smart about it.
Right. Don't just go down a rabbit hole on the internet.
Exactly. Stick to reliable sources like medical journals, government websites.
Okay.
And remember, Just because your neighbor told you something worked for them
Yeah.
doesn't mean it's actually effective or safe.
Right.
Look for studies, especially big ones, good quality ones, and be wary of anything coming from someone who's trying to sell you something.
So ask questions, do your research. What's the next step?
Get multiple opinions. If you're not sure about a diagnosis, a treatment plan, anything, talk to another doctor, maybe even a third one.
Makes sense. It's like getting a second opinion from a mechanic. You want to make sure you're getting the right advice.
Exactly. And it goes back to that thing we were talking about, groupthink. Sometimes you need a different perspective to see the whole picture.
All right, so far we've got ask questions, do your research, get multiple opinions. What else should we keep in mind?
Be careful about what I call the parachute argument.
Parachute argument?
Yeah, it's this idea that something seems so obviously true that you don't even need to study them. But that's not always the case.
Right, like with the heart stents. Seemed like a no-brainer, but it turned out they weren't as helpful as we thought.
Exactly. We always need to demand evidence, especially for things that are risky or expensive.
Okay, good point. So, last question. What's the most important piece of advice you can give our listeners?
Be your own advocate. Don't be afraid to speak up for yourself. If something doesn't feel right, if you have doubts, say something.
Yeah, that doctor-patient relationship, it should be a partnership.
Absolutely. You're in charge of your own health.
Well, this has been quite a deep dive.
It has.
We've really challenged some of those assumptions we have about medicine.
I think it's important to have these conversations.
I agree. As we wrap up, that quote by Carl Sagan keeps coming back to me. Science is a way of thinking much more than it is a body of knowledge.
Could have said it better myself.
So to all our listeners out there, keep asking those questions. Keep learning. Keep pushing for better healthcare.
And remember, it's a journey, not a destination.
That's a great way to put it. Thanks for joining us on this deep dive. We'll catch you next time for another exploration into the world.